welcome. Today we are going to discuss about another viral infection named rubella. Rubella, the infection formerly known as German measles, it is caused by the agent named Toga virus, and it is transmitted through the respiratory droplets which are released into the environment when you sneeze or cough on another person. Rubella can spread from a pregnant female to her unborn child through placenta, and this causes congenital rubella syndrome in the fetus. Congenital rubella syndrome can affect ears, eyes, heart, and brain of the fetus. Neonates born with congenital rubella syndrome commonly have four symptoms. Number 1, sensory neural hearing loss or deafness. Number 2, eye abnormalities such as cataract and retinopathy. Number 3, congenital heart disease such as patent ductus arteriosus, in which the blood vessel that connects the pulmonary artery to the aorta during fetal development fails to close after birth. Now, number 4, mental retardation. Now, the etiology of congenital rubella syndrome. Basically, scientists are not sure exactly how rubella causes defects in the developing fetus, but it is possible that it causes vasculitis, meaning inflammation of blood vessels, which damages the vessels, as a result of which there is not enough blood flow to developing organs, which can result in tissue death. Another possibility is that the rubella virus slows down the process of mitosis or cell division in infected fetal cells. Since mitosis helps drive the development of the fetus, the infected tissue might not grow properly. Now let's talk about the clinical features of rubella. Mostly rubella infection is asymptomatic, but when it becomes symptomatic, the symptoms typically show up after a 40-day incubation period. Clinical features of rubella are divided into number 1, prodromal illness, which comprises of low-grade fever, lymphadenopathy, which is the characteristic feature of rubella. The lymphadenopathy is often suboccipital and post-auricular. After lymphadenopathy, it is ananthem, which is Forchheimer spots in case of rubella, which are small petechial lesions on soft palate. Petechial meaning blood spots. You can see the illustration of Forchheimer spots. Now the second clinical feature of rubella is exanthem, which is the maculopapular rash similar to measles, and it begins on face and spreads to the rest of the body. Now, how to diagnose rubella? It is done by the lab tests, usually with enzyme immunoassay called ELISA test, which looks for rubella specific antibodies. Diagnosis can also be done with polymerase chain reaction PCR, which looks for viral RNA. Treatment of rubella. There is no specific antiviral therapy for rubella, so the treatment is supportive. Supportive means proper bed rest, proper hydration, and symptomatic treatment such as taking medication for fever. With congenital rubella syndrome, it might involve surgery to correct congenital heart defects and screening newborns for hearing and vision issues. Now, how to prevent rubella? Prevention of rubella is done via vaccine, which is a live attenuated vaccine, essentially meaning it has been weakened. Rubella vaccine is given between 12 to 15 months of age, and then again between 4 to 6 years of age.